My name is Aileen Dinkjian. I am the AVP of Population Health and the Executive Director of the Lewis San Antonio Healthy Communities Institute. So I want to first start off by asking you to think about what keeps our community healthy. Is it just hospitals or clinics? Or is it safe housing as well, and good food, jobs, schools, and a sense of belonging? The truth is, it's really all of that. And health isn't only what happens inside the hospital. It's what happens in our neighborhoods, our homes, and our daily lives. Every 3 years, our hospital is required to do what's called a Community Health Needs Assessment, or a CHNA for short. But this isn't just paperwork. It's our chance to step back, listen, and understand what is really happening in our community. We will gather data, but more importantly, we need your input. Because numbers only tell a part of the story, but your experiences, your challenges, and your ideas help us complete the picture. So right now we are living in a time when health challenges are front and center. Emergency rooms are overwhelmed, families are struggling with the cost of living, mental health concerns are rising, and we are still recovering from the ripple effects of the pandemic. Add to that the social issues like homelessness, food insecurity, and safety. And to guide this, we use something called a vital conditions framework for health and well-being. It's a framework that looks at the basics for everyone's needs, like safe place to live, meaningful work, reliable transportation, education, access to food, and social connection. If we get these right, we can reduce emergency room readmissions, keep families healthier, and build a stronger, safer community for all of us. But here's the thing, and this is really key. We can't do this without you. Healthcare providers can offer medical care, but only the community can tell us what's working, what's not working, and what needs to change from what we're doing. Your stories, whether about finding healthy foods, feeling safe in your neighborhood, or helping a family member navigate care, help us design solutions that can actually work in real life. Equally important is an issue we're seeing on the rise in our communities as well: homelessness. When we talk about homelessness, we often picture maybe someone that's younger, someone that's struggling with addiction or mental health challenges. But here in the West Valley, one of the fastest growing groups of people without housing is older adults. Our parents, our grandparents, our neighbors. Imagine working your whole life and then finding yourself with no place to go, or finding yourself struggling to pay your mortgage at the age of 65. Homelessness is not abstract. It's local, it's aging, and it affects families and neighborhoods. For too long, each of us has been working in our own corners. Healthcare systems, social services, housing authorities, nonprofits, each making an impact, but often in isolation. What we need now is a cross-sector case conferencing approach, which is something that San Antonio Regional Hospital is proud to participate in with partners around our community. And everyone will sit at the table, share information, and figure out how we can align our efforts and our resources. Think of it like this. Think of a relay race. If one runner drops the baton, the whole team falls behind. The same happens when a patient gets discharged from the hospital but has no place to live, or when a senior finally gets housing but has no access to medical care. So here we have a regional initiative, and we're building a system of care. We've launched a Housing Solutions Collaboratory for aging adults. It's a 2-year initiative funded by the California Healthcare Foundation, and it's designed to bring everyone, healthcare, community-based organizations, housing agencies, and the justice system partners to build a coordinated system of care for older adults experiencing homelessness. So, over the next 18 months, we'll be working in cycles, 90 to 120 days at a time, where groups take on specific projects. We're testing solutions, measuring progress, and then we'll come back together to adjust and keep going. It's like turning our whole region into a living laboratory for solutions. This isn't just, again, about organizations and agencies tackling issues. It's really all of us. We need your wisdom, we need your stories and your voice to shape solutions that actually work for real people. So if you're a leader, you can help recruit, remove barriers, and set the vision of what we're trying to accomplish together. If you're a participant, maybe you're a part of an organization, you can join work groups and help drive projects. And we'll be sending information about these in the near future. And if you're a resident or an advocate for healthcare, for safety, for your neighbors, you can share your knowledge, your data, or even just your connections to help us break down these silos. Because when older adults are unhoused, we all feel it in our emergency rooms, in our neighborhoods, and in our moral conscience. But when we come together to address it, we will all benefit. A healthier community, safer streets, and the dignity of every human being deserves quality of life. So today, again, I'm inviting you as a leader, as a participant, as a supporter, we need you to help us find solutions and co-create these solutions with us. Together we can build a West Valley where no one grows old without a place to call a home. Too many patients are cycling in and out of our emergency departments because of deeper unaddressed issues, including behavioral health struggles. These aren't just hospital challenges, they are community challenges that demand community solutions. At San Antonio Regional Hospital, we have a program called the Enhanced Care Management Program. And it isn't just something we provide for patients that are in high need, it's a lifelong commitment. It's about walking with patients beyond these hospital walls. San Antonio Regional Hospital doesn't operate in silo. We have leaders actively participating in long-standing collaboratives that tackle behavioral health and homelessness head-on. We are leading the Inland Empire Behavioral Health Collaborative, where hospitals around our communities, clinics, and community partners align strategies to improve behavioral health care. The California Healthcare Foundation has funded the cross-sector case conferencing pilot that we are embarking on with the West Valley region, testing new prototypes so that healthcare, housing, and social services work seamlessly together. A model where healthcare providers, housing authorities, justice partners, and community organizations gather can provide important data and share insights and help us build unified care plans. And again, we want to align our resources so we have better outcomes for our community. We are weaving behavioral health into every touch point of our enhanced care management program, from screenings, referrals, case management, and these are just not add-ons that we have, they are essential to every patient's care. By integrating these services, we don't just treat conditions, we are treating individuals holistically. Housing navigation is not an option. Patients cycling through the ED often don't need just medical treatment, they just need a safe place to go and sleep. Partnerships with shelters and supportive housing providers are extending the reach of care into the community, and we are proud to continue this work alongside with them. We have a West Valley Regional Pilot Committee shaking things up and creating opportunities for all of us in every sector to serve all patients with critical housing needs in a very holistic way. But how? Well, our goal is not to just serve our patients in the beds, but build a governance structure, something that will withstand all storms that come through for generations ahead, that will unify and unite our partners around shared workflows and shared metrics. With accountability comes sustainability and a chance to truly transform care for Medi-Cal beneficiaries and beyond. This is more than a hospital initiative, it is really our community involvement and a movement. When health systems, housing providers, behavioral health agencies, and justice partners come together, we move from fragmented care to a whole person, whole community solution. If we can align our systems around our most vulnerable patients, imagine what we can do for the entire health of our community. Together, we can reduce unnecessary hospital visits, address the root cause of our health challenges, and make sure everyone has the chance to live healthy, safe, and thriving, fulfilling lives. So again, today, I'm asking you to continue to participate in our initiatives and find out more on our website at SARH.org. Share your perspective, join the conversations with us, and encourage others to do the same. To learn more about our initiatives and the work we are doing and how we can get your input for our community health needs assessments for our West Valley Regional Pilot Program, please visit www.sarh.org, or you can email us at populationhealth@sarh.org.